At last year's gala, we talked about the need for Central Texas Medical Center to expand its orthopedic program. And one of the main drivers of that need to expand was certainly the fact that our community is growing and that there's an aging community. So I just want to round back with you to give you some updates what we've done since we talked last year about this need to expand. First, we have worked diligently with our physicians and clinicians to obtain a designation as an Ortho Center of Excellence.
The certification that CTMC has will really help patients to have the confidence to know they can have good surgery locally and have their doctors who will be following them for years taking care of them. They'll be able to have that continuity of care, and they'll know that not just numbers or patients being pushed through the way. They're friends that we take care of, and we're looking for the long-term relationship.
It involves both the preoperative and all the postoperative care that the patient receives. So preoperatively, we have a pre-admission program where nurses call the patient and answer all their questions. There's a joint class so that people know what to expect for their surgery. And then it also involves getting everyone on the same page in the operating room, the anesthesia team and all of the OR staff. And I think we've done a great job of really getting everyone up to speed on providing an exceptional level of care. And then there's all of the post-operative care that the patients receive on the floor. And the nurses have done a tremendous job of caring for our joint patients, knowing what it takes to get a total joint patient well after surgery.
So from a patient standpoint, having a joint center of excellence to do your joint replacement is very important for you because it streamlines the process. And if you think about very successful companies such as Chick-fil-A or Starbucks, you know what you're going to get every single time you go in.
In addition, we used the money that was raised last year to buy drills and a pretty sophisticated table called a Hannah table, along with many other supplies to raise the standard of work that we do at the hospital.
One of the good things about having surgery close to your home is that you'll be able to have the doctor that's going to be taking care of you for long term doing that care. And what we do is we see patients not as profit centers, but these are our friends, and these are people that I see in the grocery stores, about town. I live here, and I want to have the long-term relationship for those patients, and that's one thing I think you can have if you have your surgery close to home.
Tonight we're here to talk about the future. And as Central Texas Medical Center, we are so excited about the future and what it holds for our community and the new advances in technology. Specifically next year, we are looking to invest in equipment which will help us better detect breast cancer. So tonight we're asking for your help to acquire a 3D mammo. The 3D mammo will certainly help us detect breast cancer much quicker. I'm sure we've all known someone who's had breast cancer, or even had our own family member with breast cancer. I remember my mom when she was diagnosed. We were afraid. It was a fearful time. And we want to be part of the solution here in San Marcos. I want to thank each of you from the bottom of my heart for your support in extending the healing ministry of Christ.